trained physician offers you better advice than the person on the ground.
I don't have confidence in it.
I think the technology can really bring in transparency data.
Are you really sure that the level of training of all these 100,000 doctors that are graduating every year?
Just the thought of driving up to hospital gives people an absolute mental breakdown.
There are three things that Indians want. Indians want higher quality at lower cost at the fastest pace possible.
So I know exactly what's right for me.
So welcome to the next big opportunity. The idea of starting this podcast is to build a narrative for AI in India and how AI can help India's future in product nation, building nation where we can be competitive using tech and youth, of course. So this conversation is with three gentlemen here, which I'm going to introduce in the course of the conversation. And today we're going to talk about AI in healthcare, which is very critical to India's growth. Today, India has about 64 doctors for every 100,000 people. India has 64 doctors for 150,000 people. Global average is about 100,000 people for every 64 doctors. So the question is how we can bridge this gap that India has in healthcare. And if you're a founder looking today, how to build a next digital healthcare company, we're going to discuss the current challenges and opportunities that we have in digital healthcare in India. How can AI bridge that divide or technology can bridge that divide? What can you do to help shape the future in that? So during the course of conversation, we're going to cover the opportunities, some opportunities more detailed than the others. We're going to talk about what is required to create a sustainable business. The reason I use the word sustainable in healthcare is because safety and privacy also is a large concern, and that has to be taken care as we think of building newer companies. And more importantly, how are you going to bring in the financial inclusions along with building the healthcare, which is a key part of building a healthcare ecosystem in India. So with that, I'm going to introduce our guest for today. We have Dr. Nachiket Mor. Dr. Nachiket Mor is an economist, and he is today, current work is working designing health system for regional and national healthcare in India. He is a visiting professor at Indian School of Business. He is, working as volunteer at a mental health institute, and he has done, very, very detailed study on healthcare and, of course, financial inclusion in India. So we'll hear him what his views are from what he has seen so far and how AI can help bridge this divide in healthcare. We have Shashank. Shashank is co-founder and CEO of Practo. Practo today covers 40 crore patients and about 200,000 doctors and healthcare providers. And he has done phenomenal work over the last 16 years, very, very early on in the digital healthcare in India, to see how he can leverage the power of software and machine learning to bridge this digital divide. And then we have Viren Shetty, who is Executive Vice Chairman of Narayana Health. Narayana Health, of course, has been forefront of bringing affordable health to India. And he has been focused on building more efficiencies, how he can bring more affordability to the Indian consumer as far as healthcare is concerned. So we're going to start with, very basic. Dr. Nachiket, if you can just summarize, what is the state of current healthcare system in India?
So Indian healthcare, whether it's good or bad, but the reality is that it's very, very fragmented. 95% of providers have fewer than 5 employees, which is, no industry I've heard of or seen in India has this level of fragmentation. Even the grocery store market is starting to integrate a lot more than the healthcare market. We spend, give or take, about 10 lakh crores per year as a country on healthcare. Unfortunately, more than half of that is spent out of pocket. So think of the market in which you're going with money in your pocket, shopping from retail stores or providers. That is bulk of healthcare. The beauty, of course, is that as a counterpoint, in terms of quality of healthcare, the world's best is available to us. If I look at Narayana, for example, and look at its record in mortality, infection control, it compares with the Mayos and the best setups in the world. So if we can bridge the gap of financing, either because you have the money or because some other instrument has made it possible for you to have the money, sitting right here, you can get the highest quality healthcare. The benefit of fragmentation is that people can come to your home and deliver to you services that elsewhere in the world you are waiting for weeks and months to get basic care.
Like you saw also in COVID times, right? India was able to administer COVID at such a large scale.
Look at our vaccination
Yeah,
rates.
vaccination
Countries,
programs.
smaller countries have not been able to get rid of polio, for example.
Right.
Right. We have, for most of us, it's a distant memory. Right. And many diseases of the type that we have, malaria is now starting to become just in narrow pockets of the country. 25 years ago, you would not have imagined it. This is the power of fragmentation, low cost that can deliver. But of course, what that means is that the quality that we need of healthcare, preventive care that we need, we are becoming now gradually not just the capital of infectious diseases, which we were, and we unfortunately for some diseases we still are, but now diabetes, hypertension, not yet cancer, we don't live long enough, but as that increases, these numbers will start to grow as well.
Exponentially. But if there's a massive divide between urban and rural India healthcare, right? Because 70% of concentration is in the urban India. So how do you bridge the divide? What kind of health systems can help divide that gap? Of course, telemedicine is growing at 31% CAGR right now. But how do you think about bridging that gap? And I'll give you an example. I was born and brought up in a small town in Moga in Punjab. And there used to be only one doctor in town. I'm talking about 25 years back. And we'll all go to that one doctor. If he is not available, you can't just go anywhere else, right? And then your grandmother will give something to you, go to a local prescription shop, and he will then give you, or she will give you some medicine. That's how we lived our life. Today also now, obviously telemedicine has improved. With internet, there's a bit more knowledge. So how do you really bring how do you bridge that gap?
So the reality of rural India is that there's no shortage of providers. Every village has 2-3 somebody or the other providing it. It's also not clear, and there's good evidence on this, that the trained physician offers you better advice than the person on the ground. It's not obvious that more certification means higher quality, right? So I don't think the problem of ours is sheer availability.
Got it. I understand.
The challenge is, what is the quality being delivered? When is it being delivered? Is there some of the principles of what we call primary care? Are they being followed? Is somebody worrying about me? In a well-developed integrated system with insurance and others being tracked, if you don't go for your checkup, if you don't get your cervical cancer exam, somebody calls you.
Right.
In this market, that does not happen. And that makes a big difference in terms of what healthcare outcomes that you're able to get. And a fragmented market is not able to deliver something like this.
I understand.
Can I get a metformin in a remote village? Most Indians are a half an hour walk from a pharmacy.
Yeah.
Can I get a third generation antibiotic? Maybe I need to walk another hour, right? This is available. The challenge is, what am I doing with the health of the people?
Got it.
Even in basic care, mental health being now newer set of issues that we're becoming aware of, another kettle of fish that we have to deal with. So those are the challenges for us, and this is where, what we are going to talk about, technology more broadly defined can really make a very big difference in what we actually deliver to the individual.
Yeah, so basically summary for the audience is focus on what medicine can deliver or science can deliver through technology. We're going to come back and talk more about it. But Viren, coming to you, you of course have much wider experience of delivering that primary and tertiary healthcare and through affordable, medicine and through hospitals. So what is your view on Indian healthcare and what are you seeing on the ground?
See, I think the point that Nachiket made was very valid. We are hugely fragmented. You add up all the organized hospital groups together, we don't even constitute 10% of the bed strength of the country. Half the beds are still available in the public sector. Public sector hospitals have their own challenges. There's a lot of issues with funding and accountabilities, but it leaves a massive unorganized set of operators who are providing some level of care. What I see as the next big wave, and something that anyone who's looking to get into this space is thinking about what I can do to make a mark. Sure, you can go and create a completely new solution. You can invent a new medicine. You can create a new system of surgery. You can invent a new machine. Or you can say, all of this entire fragmented system of operators that exists in tier 1 towns, tier 2 towns, tier 3 towns, where there's nursing home, single doctor running a clinic, a pharmacist, or a group of people who came and put up a hospital. What can I do to make them work on par with the chain, large, organized, corporatized healthcare systems. Because I think our biggest problem is that the defining standards of healthcare in this country are built around systems that look like us, which is very large, compliant with 21,000 local and national regulations as well as international regulations, have to hire armies of people to do everything and have to be so careful about everything that they do. That cannot scale down. So that's why in tier 2 towns, tier 3 towns, you don't find too many hospitals. If you cannot scale it down, if you cannot turn this into a McDonald's, how do you expect to provide healthcare to the last mile? So working on new methods, new alternatives, yes, great. But if someone can apply a lot of thought into really breaking down every single portion of the process of giving care, take the same doctor who was there, take the same patient who was there, take the same medicine who was there, but wrap it in a new system of delivering all those three. That, I would say, is something that a lot of entrepreneurs are working on, a lot of entrepreneurs in the future can continue working on, and this will be a business model that's been good for the past 10,000 years and will continue to be there for the next 10,000 years.
And when you say system of delivery, let's elaborate like that. As if I put myself as patient, right? Today what I do is, let's say I have a fever, I try and find the best general physician in town, I give a call, then I go to hospital in Narayana Health or I go to Manipal or Apollo, then I wait for 2 hours because the line is too long. And then, doctor will look at me and then order some test. Then I go to lab, they'll take my blood sample, result will come the following day. And then I'll again go to doctor and then some prescription will come, which I can then order on Practo or Tata 1mg or one of these, or I can go to local shop and buy, right? So are you talking about making that experience more seamless when you talk about the delivery of healthcare?
No, that's one aspect of it. So you're presupposing that that person even ended up in a hospital and knew that they had a fever and what kind of fever it was and whether there's a fever that was cured by a normal paracetamol or whether it's a fever, maybe it was a COVID or H1N1 or some other thing. I'm saying even more simpler. How do you get people to go to see a doctor when they have fever? Because right now, just the thought of driving up to hospital gives people an absolute mental breakdown. And I don't blame them. It is a horrible experience for most patients to have to go through a hospital, whether it's a corporate hospital, government hospital, college hospital, doesn't matter. The thought fills people with fear. So they go online, they self-diagnose, they go to pharmacist, they pop some pills or they ignore. Most Indians just ignore.
Wow.
So you break it down into something simpler, far more accessible, that is comprehensive enough and conveys trust and quality and comes with a brand attached, then you reduce the barrier for that person to come and say, okay, I have a problem, these are my symptoms, can you suggest to me what the problem is?
And the reason that delivery cannot be simplified because the way the current infrastructure is, the regulation, the capex required, and the way the delivery mechanism is very complex and it is only tuned to large scale hospital systems.
See,
is it a fair way of putting it?
Another way to put it is that you are building for that. You're building all that regulation, all that compliance, all of it assumes the highest end of care, which is someone coming, putting anesthesia on you, cutting your chest open, doing something inside your body, stitching you back up, and you survive that whole endeavor. That is what the regulation is designed around. Most healthcare is not that. Most healthcare is far, far simpler. But because this is where all the attention is, this is because where a lot of people have fear that if this is a persistent fever and I've not been getting relief, I have to go to the highest end place to get that treated. And so you end up going in the same line as someone who has cancer or someone who has very advanced heart surgery.
Got it. So summary for all of you listening to this is that there are far more simpler problem which you can integrate or break it down to simplest step and see how you can deliver the care in a very meaningful way and affordable fashion. And that brings me to Shashank, to you. Of course, you started Practo when I think the digital healthcare was very, very new. Not many people were looking at it, right? Of course, and you have your own experiences. So we'd love to know coming from not a provider background, right? You coming from purely a tech background, looking at the problem in a very different way. So what has your journey been? What your experience has been in understanding the healthcare problem in India?
I think the outside in 30,000 feet level answer is that there is accessibility problem that can be seen starkly in a tier 2, tier 3, where we are seeing close to about, just in number terms, $10 billion of, I think Nachiket spoke about 10 lakh crores, give or take about 100 billion in that ballpark. And 10 billion of that, is medical tourism. And in that medical tourism, only 20% are patients coming from outside India to Indian providers. A majority, 80% of it is domestic tourism, where people from smaller locations are coming to major cities for their treatment. So there is a lack of specialists and a lack of access. So there's an accessibility problem. That's the kind of accessibility problem that you see in a tier 2, tier 3, tier 4 town. And then in a urban town, the accessibility problem is more a little bit more privileged kind of accessibility problem, which is not wanting to use the Bangalore roads to visit a facility or wanting care at an odd hour of the night. And that's the accessibility problem that urban India has. In the domain of affordability, clearly there is rising costs. There's rising inflationary costs in healthcare delivery, which is a matter of concern. And the third one, which is the quality. And I think Nachiket touched upon that and also Viren touched about the fact that there are no standardization. So there is a lack of perceivable quality, and hence there is a brand, there's a trust that's put over brands. And so there is lack of objective assessment and objective quality standards that are there. This from the consumer standpoint, so it's at a high level. So what does how can technology, or from an outside-in technologist try to solve this problem, is by trying to figure out how data can be used and how maybe some sort of marketplace can put together. So what we did was we put a marketplace together. Today we have close to about 7 lakh doctors on the platform. We have 200,000 clinics and hospitals on the platform. That is trying to solve the accessibility problem by putting this data and ensuring that for an urban and a non-urban Indian, this accessibility problem is sorted out. Second is data around pricing information, data around affordability information that's not available. Today, there's like a black box when it comes to what is the pricing that's available at different types of healthcare establishments. That's something that, again, data can solve. And the third, which I think is also very important, the quality side. It's very surprising about the lack of data around health outcomes. And it is difficult to measure, yes, but there's real lack of genuine data around health outcomes. And so that makes it very difficult to objectively put together some kind of parameterized answer to quality, which can be done. So I would say that a technologist's view of this problem is more data can make this healthcare delivery, which is more a black box today, for many Indians, make it more easier to understand and then transact and then utilize. And data could also be used to incentivize the right providers for the right behaviors. And that could lead to better financial outcomes for those providers, which could lead to better incentivization of the whole ecosystem. So in a short answer, I think the technology can really bring in transparency, data, and the data can drive the ecosystem, both at the consumer side and at a supply side. And data is of all three aspects of accessibility for Indians.
And so let's talk, what I call this actually 5X framework, right, with technology coming in. So I was writing my notes down, so I built this metric. So for example, if technology can make doctor 5X more work, right, which is doctor today is spending a lot of time in routine tasks. If AI or technology can help automate, so if a doctor can see 5x more patients, or there is a 5x reduction in doctor's work because doctor write a lot of notes, doctor do a lot of post after seeing the patient also, they're doing a lot of work. So if you can do the work. So a lot of research which is continuous. When you look at cancer, diabetes, or normal, new viruses are coming. So doctors have to keep up with a lot of research. So can technology help in reducing the time, summarize the research for doctor? So that, or automate in a way that doctor doesn't have to spend so much time reading through 5,000 page documents and understand where the research is going. Or reduce the error rate, right, which you talk about procedures or protocol quality, right? Or 5x faster diagnosis. And of course, then 5x cheaper. So I think if we can talk in that framework, if we can increase the productivity therefore by 5x, then I think AI can help a lot.
But see, I would say that's still an old view, using tech to make that old better. What if we said, we reverse the roles? The tech is your provider. The doctor is assisting the tech. And now it's no longer that, because, error. doctors can make significant errors in a repeatable task.
Yeah.
Why do you want to get error involved? Number of graduates that we have on the medical system. Are you really sure that the level of training of all these 100,000 doctors that are graduating every year is up to scratch for basic conditions? Right? What if you reverse the role and you said that now we know a lot about what to do for basic diseases, which actually is 80% of the burden.
So 20% doctor basically.
No, the doctor is involved,
Right.
but now is assisting the tech. And really no longer thinking about, can I take an old task of writing notes and automating it? Why do I need the notes? Right? Because I'm now having structured conversations with people. I'm receiving a lot of data from multiple devices. The notes idea, maybe it's a historical idea that we are now trying to capture in a new setup. And particularly young people that are thinking about new ways of thinking about this. I would say don't start by talking to a senior person and saying, how can I make your life easier?
Interestingly, I was looking at one of the business plan and team came in and they were exactly saying what you said. So they were actually shadowing a doctor and understanding the day of life of a doctor to see what better system can I create or can I create an AI doctor. I think what you're suggesting is reimagine the total way of looking at it. And that's how the AI, so-called AI doctor, which can replace 80% of the work that doctor will do. So doctor will
still
be
a
needed.
need for judgment.
Doctor,
There is still a need, but a lot of it's programmable.
Yeah.
A lot of it, the system can start to guide. And of course, the doctor comes in when asked to by the system, rather than the system comes in when asked to by the doctor.
I understand. Viren, do you agree with it as a provider?
See, I would say that using AI to replace some of the basic functions of the doctor, yes, anyone will happily use a system of automation to get rid of rote, repeat, things that are very obvious. But basic diagnosis, I believe, happens at home anyway. Most people are anyway Googling symptoms and taking care of it. I think that the escalation matrix for the things that get you into the healthcare system are of a higher caliber, because I think it's more or less enough. I think if you know how to do Google search, there's an assumption that you have some base level of knowledge and education. And so you have the ability to go to the pharmacist and pick up what are the basic antibiotics, antivirals, and painkillers and some steroid cream can take care of almost 80% of the basic issue that come about. When you're entering a health system, the assumption that the barrier is a lot higher. Like the difference between making food at home and going for a proper meal cooked by an expert. So if you say the AI can replace doctors, see, I think AI can replace some of the nonsense things that doctors are subjected to. So if someone can get rid of all the, a lot of the simple taka typing, if someone can get rid of a lot of the note-taking, form filling, the things that waste a doctor's time, yes, can replace the task. But can we use to enhance human productivity? Absolutely. So it will replace the nonsense things. And so this was an example that I always give to any startup person who comes and says, can I make an AI doctor? I said, today's planes, the modern aircraft, the ones that are on the fly-by-wire, have had autopilot since the 1990s. From 1990s onwards, every aircraft has had the ability to take off, fly, and land fully unassisted. Then he asked, why is the pilot there? And I was sitting in the cockpit when I was a kid. I asked the pilot that, why are you there? Aren't you worried that the machine can take over your job? He said, all that is fine. You talk to anyone at the 300 people at the back of the plane and ask them, will they get into the plane if they know I'm not there? So these things are good in theory, but you will always need a human behind the wheel.
Yeah, of
and
course.
So the AI doctor will always need a doctor behind the diagnosis. So a truly AI-generated diagnosis without any grounding in human experience, human intuition would be, so in the AI terms they call that hallucination, but in the end, even the normal consumer may feel quite unsatisfied by that. They say this is not a real thing. So the head of my AI division, his father had some slight tremors and he was walking unsteadily and he got really worried. So he took him to one of the doctors in one of the large hospital groups. The doctor did he followed exact protocol, did the line by line test. He said, do this test, do that test. And in the end they said, you have a serious issue. It's a neurodegenerative thing. You need to get on this huge cocktail of medicine and you have to take steroids for life. And, my he got really worried. He said, no, I need to take a second opinion. So he went to another doctor from our system. The doctor took a look at all the tests and said, oh, it's just a vitamin B12 deficiency. It's very common for Indians of that age because he's vegetarian. You know, the diet is very poor in eggs and meat and so on. So take this tablet, you'll be fine. So one is ground in protocol, one is ground in knowing that Indian vegetarians tend to have that deficiency. Right? Now, you can program, obviously. You can program
No, in
software
a sense,
to do that.
what that illustrates is the human error.
Yes.
It illustrates why something that should have been more complete with data, somebody took a judgment based on limited understanding and made a mistake that could have cost somebody their life.
But isn't that all programming? All programming is just
I think
finding
as
out
it
the
learns
next...
quickly and becomes context specific, it'll outpace an error-prone basic care. See, advanced care, no question, some judgments will be needed. But basic care, and as somebody, in a way, the doctor is there. It's not as if the doctor has completely vanished from the picture.
Yeah.
It's much like autonomous vehicle these days, right? We're all going to be used to that, right? Still,
No, I sat in my friend's Tesla, which was on full self-drive mode. It drove like how, we drive in India, but this was in the US. So you can't drive like in India when you're in the US because it's really going to the curb. It's making fast breaks and stops.
Oh,
it
is
was
that
a
right?
terrifying
I also
scary
tried
experience.
I also
Very
tried
scary
Waymo in
experience.
San Francisco City.
No, because it has confidence, right? It knows it can stop.
Yeah.
I don't have confidence in it.
Good point.
I think trust is the biggest issue. I was quoting the experience that I had in Waymo in San Francisco. We all got in the car and it took us to the place, but I was anxious and I tried 3-4 times and my anxiety was a little bit lesser the third time, but I was anxious. I think, so in this also, I think the important aspect of trust also is going to establish, right? And Shashank, of course, you're playing with a lot of data and I'm sure you will launch AI Doctor one of these days. So what is your view on this? So there is a point in time where obviously AI takes over in a way, right? If doctors are going to be replaced. And there's the issue of empathy and trust which doctor brings to human interaction, right? There's also a view that ultimately humans are treating humans, right? So can AI being human and can it treat humans, right? So what's your view?
So AI Doctor, we should be the most excited, right? Because we've been in digital health for so many years and finally this technology comes up which can be leveraged and delivered. But I would say that, is the technology promising? Absolutely. Can it, assist the doctor or, one can decide whether it's assisting 20% or 80%. There is an interplay between the two. But one thing I'll definitely share is that healthcare quality will certainly dramatically go up. Now, can it be replaced? I really don't know if that's the real question you should be asking. I think the real question you should be asking is that there are 3 things that Indians want. Indians want higher quality at lower cost at the fastest pace possible. So can we make that happen? I think that can happen.
So let me ask,
that is more important. From a technologist standpoint, that is more important. From a consumer standpoint, that's their perception that's more important.
So let's drill down to the cost element. So to what level the cost will come down? If this becomes a reality, even 80% of, as Nachiket is
I think like in healthcare there are three levels of if you can call it anxiety, right? Primary is the lowest level, so where the issues are a little more easier to manage. Then comes secondary care and tertiary care. And I think the example that Viren mentioned was on tertiary care, which is where you feel that there is much more of a risk to your health, to your life. When you come down to so all innovations, especially this innovation, will start off with primary care, and I think, like Nachiket also mentioned, it will start off there. And there, what is the cost benefit that one can see? I think, like you rightly called out, I think there's it's more like I see the expansion of the pie. To give you an example, I used to do X number of Google search queries. Today, I do X number of Google search queries plus Y amount of OpenAI, ChatGPT plus Z amount of Perplexity. So the pie has increased. So the problem that I have seen in healthcare is there's a trust deficit, which also prevents the consumer from reaching out to a provider because they don't know that, hey, what will the provider say? Now, if that was done at a convenient way, I think the number of queries will go up. So primary care queries will go up. So your ability to make sure that I have a doubt, can I ask quickly instead of a doctor and AI, which is assisted by a doctor? Maybe yes. So, and if that happens, today what a consultation could cost would be a fraction.
So today, for example, I pay, at least in Bangalore, 800 rupees to 1,000 rupees per consultation for a good general physician, right? So can it come down by 1/5
So there'll be 3 numbers.
Yeah.
There'll be a free consultation you'll get. Okay,
Where
which
is
will
the free consultation?
Yeah,
I would
free
love to
consultation with a very high quality.
Right.
There'll be a consultation at a very low price, assisted by a doctor, and there'll be still the 800 doctor. So it depends on what level of trust you have in these three entities. Just to give an example, you have a very prominent brand hospital with a doctor. You have a smaller clinic with a doctor, and you also have a very not so good setup with doctors. So there are all three available today as well. So you will have these three. I think as the onus is on the provider to invoke the trust. Can even the free consultation, can it evoke the trust that I'm doing the right thing by you? And so today the question that is to be asked is that can I convince the consumer I'm doing right thing by you and prove it to the consumer over time and also to the rest of the ecosystem that I'm doing right thing by you, right? That is what I think has to happen. Just to give an example, I think Viren spoke about two diagnoses. Now one can even say that we don't know which one is the perfect one, right? Because time will tell. Now the problem that we do have is that we don't have enough data that suggests which is the right eye health outcome, right? Are we ignoring when you go to two providers, they could give you two diametrically opposite answers. Now, only time will tell whether the diagnosis was right or wrong. So I think that the need for data, the need for this thing is certainly there.
I think so. One of course is a trust issue, right? And I want to summarize that for everybody that what we're talking about is the opportunity of AI doctor, in which we can expand, of course, as you're talking about the reach of which people can be treated. But the key discussion we're having is trust and the cost, of course, right? But I think one of the biggest aspect of looking at it is that a lot of people who are not in the network of even coming to a health provider will actually start looking at it, right? So the trust comes into picture when I have an option. If you go to rural India, I may not have an option. If I am a daily wage worker, right? Where I have the option to spend 500 rupees to go a physician. I have to eat and I have to feed my children, right?
So that becomes the relative cost. So
yeah.
If it is so simple that 500 rupees could cure it, then you'd go for the free option. You just go to the pharmacist, you go to someone else, you pop the pill, it's done. You're not paying 500 rupees. The time you enter the medical system at that income level is if you are something absolutely life-threatening. Right, so let me put another way. Is when you have a sickness and you're seeking a cure, is it a generic product or service you're seeking, or is it a bespoke, customized specifically for you?
So generic will be...
If it is generic advice, it should be free and it will be free. So someone with illness will just do Google search or they'll look online. But if it has no value, then you as a customer also will not pay for it. So you have to really think about what the business model you're going to create around creating just very bland, plain vanilla, generic information that your customer is not valuing because someone else is offering the same thing for free.
Yeah, right. But today I want to build on something Viren had said earlier and something with this trust conversation. I don't think there is a trust deficit. People already trust a lot of people. You might wonder why they trust that person. I think what Viren said, which struck me a little bit as an interesting possibility for a young person thinking about it, is that I already have the trust. It's the local pharmacist, the local whichever person that I call a physician I'm seeing. Can I unplug the low quality decision engine he is using, plug in a high quality decision engine, and make the quality worthy of the trust? I think we have the trust we have, we don't have the quality.
Yeah, absolutely. That's a beautiful way of putting it.
Is it possible for us to say that, I'm working on a paper for somebody else who works with pharmacies and supports pharmacies? It was an interesting insight I got. Originally, my thought was pharmacies must be seeking his help for primary care. It turns out not. It's like what Viren said. For primary care, either person is deciding what to do or the pharmacist is telling him something right or wrong. It's when, as they say in Hindi, jab pani sar ke upar chala gaya, then the pharmacist is turning to a back-end player. So all the consults are high-end neurology consults, bipolar disorder consults, rheumatism consults, coming from distant villages. What is the choice? 900 kilometers away is the nearest hospital. Now, that is one way in which this operator is taking the trust engine. Now, you might say, why is this person going to the pharmacist? Why is he not calling me directly? Why? He doesn't know me.
It's a local access,
He knows this person.
Yeah.
Can I unplug that backend and plug in a much higher backend, which, it clearly opens up a possibility.
Like what happened in the diagnostics, right? So if when ThyroCare came in, right, we all used to go to labs and wait for some time, give the test, and the result will come after 6 hours or next day, right? But now today we are very comfortable after COVID, where somebody coming home and taking the sample and then you get the result.
But that is
next
still
day.
behavior change. What I'm saying is in healthcare, generally, behavior is hard to change.
Okay.
Trust is hard to replace.
Yeah.
It's better to replace the back end of the trusted person than to replace the person.
No, what I fully agree with you. What I was going to is that while we are talking about the trust as a doctor or through pharmacies, there's also a diagnostic angle to it, right? Because a lot of it is also depending on the tests. And the penetration of diagnosis center in the rural India is also very poor. So if I have to treat somebody for whether it's a dengue or it's a chikungunya or a normal
See, but
thing,
that really is where tech can make a lot of difference.
Yeah.
For example, much of what people are doing is drawing blood.
Yeah.
Right? Drawing blood is an easily scalable idea in the remotest location. Drawing venous blood, drawing pinprick is easy to do. Slide making is easy to teach. In fact, in most hospitals, it's technicians that are making the slide. There are now technologies that are able to automatically, you put a slide in, take multiple photographs, including cell structure, all of that. They can give you an AI diagnostics, or they can send the image.
Back to the...
And now people are building newer and newer. I understand, now I'm not an expert in this, but CRISPR technology, level technology will become available for primary care settings.
Yeah.
Where I can bring the diagnostics absolutely to the remote area. I need the ability to collect blood. Currently, that is the gold standard that gives me the most value. The non-invasive technologies have proved to be, there's still work to be done in there. But if you look at ECG machines, they have become miniaturized to the point where I don't need to send somebody somewhere. I would say the opposite will happen. More and more of not just the sample collection, the actual analytics will move closer to the patient.
Which is what you call a browser moment of healthcare, right? Which is everything comes on your phone in a way, right? Where today, for example, Apple device can check your ECG, right? It can check your heart rate, it can give you
and
HRV.
Imaging, I'm not the expert, Viren or Shashank will know more. Imaging, nobody can match the machines. The ability to reach 5 lakh pixel points, human beings just do not have. There was no other choice, which is why we were doing it. But now, with improved technologies.
So a lot of work is happening in
I'll add
imaging.
one more thing. I'll add one more thing which is very surprising. And what we found is that when we started collecting data around why don't patients recover, right? For what was interesting to us is that when a patient finishes his treatment cycle, which is maybe for different treatments, it's different periods. When you start collecting the data, one thing that we started looking at is that why don't patients recover? And one of the things that we saw was that the patient did not recover because he did not take the treatment. He went to some other doctor. So we started understanding that the largest reason for non-recovery of a patient was that he or she did not take the treatment, even though the treatment was right. Now that was very fascinating for us. So half the patient did not recover because they didn't take the treatment. They recovered eventually because they went to another doctor and took that treatment. So then we started understanding that why did they not take the treatment? And then we realized, started seeing was this trust score. We started seeing that doctors who for whatever reason the doctor is not aware of this, but used words or had that body language that did not convince the patient, also resulted in the treatment outcome, right? So it's not just the what they call it's not just the diagnosis, but it's also diagnosis plus the trust which results in the outcome. So we started measuring this and we started seeing that the duration of the consultation, the kind of questions that were asked, did the doctor ask enough questions? Did he use the right words? Right? In many different parts of India, there are different types of words that you need to use so that the patient feels that comfort. Now, for a doctor, it's very difficult because he's done this for so many years. Imagine doing the same thing for 25 years, the same diagnosis, right? After 25 years, that's a very challenging thing for the doctor to do. But if the AI can ensure that the doctor is doing it a little, these things may not come automatically to the doctor. Of course, with experience, it might come, but through the long day, he might lose this train of thought. This AI can actually provide this information, similar to something that you mentioned about 3 lakh data points. When we measured our 10 million health consultations and we took that data, we saw these kind of patterns emerge, which could make a new doctor or even an experienced doctor far better in not just his diagnosis, but also the human aspect. which could be very effective.
So you're saying AI-based coaching.
Yeah.
Because
That's an amazing
the
insight.
doctor takes so much time to learn whether the patient took his treatment or not. So because a digital platform can see the full loop, right? You can actually monitor the patient for a 1 year, 2 year time period and have continuous access.
And Shashank, it happens a lot with my wife because in Bangalore, kids fall very sick. You have small children as well, right? So every 3 months, every season change, fall sick. And after a point, there's a myth that you can't take too many antibiotics, right? So my wife won't give. She will go to a doctor, and he or she will prescribe that this antibiotic, this thing, and say, I'm going to wait for 1 week and see if my son is
being smart, let me tell you. Because antibiotic resistance is going to be the longer term consequence of overly aggressive use of antibiotics. Now, I don't know the specific illnesses, but
yeah, this is a general, weather change, weather viral comes and typically antibiotic comes into play. But I'm talking about the same insight, right? A lot of time we've brought all medicine also, but we're not giving it. And sometimes child is recovering and we have not even administered the medicine at all. So it does happen many times. So Viren, moving to the next level in AI, doctor automation using AI, are there any specific specialities where AI can have more impact? For example, diabetes, we're already seeing that, right? Lifestyle disease, you can measure a lot your eating habits, your sleeping habits, and how you're living your life, right? And then you can give intervention, right? Similarly, in surgery, we spoke about when you were talking informally about how robotics surgery is coming. So are there any specialties where AI will have a faster impact than others?
See, the highest impact so far was in current. Everyone confuses AI with LLMs right now, but AI has been around for a long time. It's just very advanced algorithms. Imaging. So Nachiket and Shashank had both mentioned in pathology and radiology today, no pathologist is going to actually sit and count all the red blood cells and white blood cells. There's a simple tool that will just count it all and tell you exactly the presence of whether it's the viral load or what your WBC, RBC count is. Similarly, for radiology, most of the MRIs and CTs, so these are essentially giant spinning magnets that make a horrible noise. It takes a lot of time and it's quite annoying for a patient to have to go through. Now they just implement AI, which can take a less resolution image and then it will upscale it. Or it will then focus on areas where it finds anomalies and provide much higher resolution for that. So that we found in all the images that we have, that the newer machines we get, tremendous value. So anyone today thinking about what are the current generation applications, the most advanced is in image analytics, which is looking at slides, looking at a radiologist report. Outside of that, with LLMs in healthcare, a lot of it is just POCs. I would say the one thing that I can deploy across my hospitals with absolute confidence that this thing is not going to do anything dumb would be just transcription, which is say something, translate exactly what I said. Don't invent anything new. So there, at least, a lot of the newer LLMs are much better and cheaper at voice transcription than the current system that exists in the market. Everything outside of that, you have to worry a lot about the amount of bias that is coming in, enforcing. See, if you're trying to do a standardized set of protocols, those are much simpler algorithms. You don't need the power of an OpenAI or any of the other LLMs to be able to create that. You create the protocol yourself. It's very simple to create a much easier algorithm to deal with.
I understand. But what about, I was making some notes in research. What about dermatology or even emergency, rooms where they're always, very hard to follow the protocols, and when suddenly there's so much rushes coming in and then shortage of doctors at that time. So any impact there?
See, I would say that it depends on what the solution is. See, are you looking at a faster diagnosis? I would say at this point, no doctor is ready to trust an AI to do a diagnosis. You can use the AI to assist, but still, the time it would take for you to run the algorithm in your head versus the time it would take for you to type out everything and the time it would take for you to read it out physically and then say, do I agree with this or not? You're not really saving any time over there. Now, is it about, if it's AI in dermatology, then essentially there are these tools that allow you to take pictures of your mouth for any oral cancers and any sort of small tumors or dermatology things. And the AI can tell you whether it feels cancerous or not. But that is a very low-end solution. It's something that doctors at this point don't yet fully adopt in the way that should. Eventually it becomes standard of care, but it won't take away the fact that crowd is real, patients will wait, and there's a lot more business model innovation that's required to deal with that. It's not a faster tool that will make me deal with that.
I understand.
But so I have a point of view there. I think that preventive care and primary care is probably the first places where we will see the full use of AI, and I think even preventive care as well. I think is a golden opportunity. I think the number of the use of AI, like what Viren said, if at a lower resolution using AI, if you can amplify, that's a very important thing, because the higher the imaging quality, it's also the higher radiation that you're exposed to, and that's why some of the machines that are not used very often, because they're only used when the risk of something is even greater than the risk of using the machine. If the AI can help make that common use, right, reduce the radiation a lot, such that the actual use of it can increase, then your ability to use these machines in screening, in ability to catch things earlier, is far higher. So I think it will start off there, where the risks are lower, the rewards are higher. So that is in preventive care and primary care, and then it will move on. And I think the LLMs have solved the problem of audio, video, and transcribing real time across languages. So I think this can also be, to go to your point about how in rural India the accessibility is a problem. So somebody could be speaking in Bhojpuri, and there could be an English doctor on the side, and this is something that's not futuristic, but it's possible today. And could talk real time and could with AI assistance.
At that point, I'm going to get the fourth guest, which is ChatGPT. So I'm going to ask the same question to ChatGPT and see what it has to say. Hey ChatGPT, we are discussing the potential of AI in bridging the gap in Indian healthcare. Would love to know your views.
Hey there, what's on your mind today?
We would love to know your view on potential of AI in Indian healthcare.
Sure, I'm here to help. What do you want to know about AI? Is it about its applications, future trends, or something else?
I would love to know about how AI can help in Indian healthcare.
Artificial intelligence, or AI, refers to computer systems designed to perform tasks.
Is it the latest version? I think.
Learning.
But there are 2-3 other areas, just to add to this discussion, that I feel there is value. One is a field I'm trying to do more work in is mental health. A child is talking to you, a woman in distress is talking to you, to understand what she's saying. I'm not a big believer in algorithms developed real time. There's a real chance of hallucinations there, risks there. But understanding what she's saying, interpreting that. There are 2 million possible nodes you could go down.
Right.
I think the LLMs can make a fairly big impact in trying to understand where you are, where you don't want to go. I went to one facility some time ago in which they are serving global communities. They were dealing with a large crash, one of these pileups, where, tens of people were showing up with severe head injuries. They were entirely relying on the AI algorithms to tell them where the aneurysms are, because they need to start working right now.
Faster.
The doctor has identified one based on his understanding, but there are 8 or 9 others that are much smaller that he or she has not figured out. And clearly there, one can see a fair amount of use of these imaging technologies trying to be used in complex kind of frontline settings, which can make actually quite a lot of difference to quick action being taken.
What about the sleep medicine? Not much has been, there's a lot of new narrative, at least in metros, about sleep medicine, right? And lack of sleep, and then lack of sleep leading to so many other diseases as well, right? So can AI be applied in sleep science?
Yeah, you should use the AI to turn off your email after 6 o'clock and all your phone calls should be diverted and you sleep perfectly. And to make sure Netflix doesn't work after 9.
Okay.
But the understanding of sleep is still evolving a little bit. Just like online gaming, we had always assumed these are causally linked. And the direction of causality is lack of sleep, dementia.
Yeah.
Right? Online gaming, mental health problems. The research is showing we may have gotten it wrong.
Or
The
wrong?
direction
In what
may
way?
be the opposite. That those more likely to have dementia are facing sleep problems. Not that sleep is causing it.
I understand.
Those that are
Having a problem is therefore going to less sleep, basically.
and those that are having trouble with their mental balance are spending too much time on games. And it's possible by denying them of those games, there was a beneficial impact of that online world that we are taking away, right? So we don't know quite yet. For example, we evolved not to have continuous sleep. In fact, we evolved to really sleep fully, what we call REM sleep, only at the time at which the night hunters have gone to sleep and the day hunters have not emerged. So that is the time only when we are truly safe. And my understanding, the brain actually shrinks to allow a wash to be given in that very deep sleep. But otherwise, our sleep was always broken sleep. This idea of the 8 hours of continuous sleep, my understanding of the evolution is it's a modern idea. We didn't have this, you were always somewhat alert, except in that a few hours.
But at least now, I think a lot of awareness has come. So there's also pros and cons. At least devices can measure your sleep and understand where you are at any given point in time.
I wanted to come in there I feel that one of the big things with AI that will happen, I'm hoping, is that I feel like a lot of treatments, one of the biggest issues that we have is that it's diagnosed too late, right? And I think that is one of the things that I think has to get resolved. I know of close family members where late diagnosis has been fateful, and I think that is something that has to go away, right? And we have to make healthcare, intuitive, approachable, and easy to use. That the consumer, I call it consumer, the patient is using it even for small things like sleep and getting the right inputs at the right time and getting the right escalations at the right time. So that, if a provider is able to access a treatment, access a disease early on, the options are far more wide open.
So let's spend some time on this now. Move from AI doctor to diagnostic to now preventive healthcare. Golden data set, right, of patients coming in, the disease, and at what point in time they have certain diseases, right? And of course, you have now 40 crores patients that have gone through the system. So a lot of data on that as well. But if as a common person, let's say I am diabetic and I know it's a hereditary disease, my grandfather had it, my father had it, and my son or daughter are likely to have it, right?
Yeah.
So what are the things that I can do to prevent that today? Today they are in their teens, right? So now most likely I got diabetes when I was 40. My father got diabetes when he was 55 and my grandfather probably 65, right? And given the lifestyle and what we eat and the sugar content and everything, probably they will get it in when they're 30s. So what can I do today? It's a question for everybody, right? What can I do today to prevent that?
A panel with three of us, none of us doctors.
No, but as an approach, not as a...
So I'll tell you in my own family's case, where on my mother's side, nearly all my uncles are diabetic. On my father's side, at least half of them would be diabetic. And I'm Indian. So all of these are risk factors. And so I know at some point, this is a risk factor I will have to face. And so I recognized that very early on in my 30s and said, this is not a good life. And it's not something, because I work in hospital, I see the most extreme versions of what diabetes, because diabetes being a lifestyle disease, it's something that is the entry point to a life full of misery and ending up in hospitals for one ailment or the other. And since it's purely lifestyle is what? Diet and exercise. And so say if you're able to proactively address those two things. Diet meaning track everything. Keep a log of all the things you eat and say, these are the good things, these are the bad things. Not to say don't eat the bad things. What I'm saying is that you log everything, and there are apps that allow you to do food logging, and it will tell you, okay, this thing really is very high in saturated fat. This thing is very high in some ugly carbs. This thing is really high in sugar. Should not. And so there are full AI backends available that you can take pictures of your food and it will tell you exactly this is the caloric count and so on for that. So that helps you be more mindful about the things you're putting into your body. Last part is exercise. Exercise, there's passive monitoring and there's active monitoring. Active monitoring is when you wear the smartwatch and so on and you do, okay, 30 minutes, I'm going brisk walk, I'm doing the exercise, all of this. It'll tell you these many calories, these many things you've done, but that maybe you need to measure, maybe you don't. Everyone should get half an hour exercise a day. The more important thing is the passive monitoring, which is what are you doing throughout the day? It doesn't matter. Even if you do 1 hour of exercise per day, if the rest of the day you are sitting on couch and eating chips and having a very bad... No. So I would say that the role of technology in preventing diabetes would be in all the things you do before that happens. And that would be monitoring everything, logging all of that, and wearing some sort of tracker to see how many steps you're taking and what your life is like when you are just walking around.
Yeah, so that, I deliberately took that example to showcase the point that you're talking about, right? So now India is a massive diabetes capital because of our eating habits and we're Indians and all those things lead us to very prone to diabetes, right? So now, to what kind of impact can be created through preventive healthcare?
I think Nachiket would talk much better about this than I can. Is that AI? It's not there yet, but in a very soon, and maybe Nachiket will say that it'll happen. It's already there. Is the ability for us to understand our digital twin, right? And I know this has been a topic of a lot of research as well as attempts in the past. But I truly think that the time is coming very soon where we'll really understand health from a outcome perspective. What I mean by that is that today we celebrate a cake on a calendar, but we don't really realize that we're celebrating a 30th birthday, but our body is celebrating its 50th birthday, right? And if you take the life expectancy and you do a little bit of calculation around your family, you're actually 75. So you're 30-year-old, but actually you're only 25 more years. I'm just putting an extreme case here. So I think if AI can, probably people are going to watch this on YouTube. One Google search query, one YouTube query away is what to do. The problem is why to do, right? And how do you make that an intrinsic motivation of a human to do it, so that he or it's selfish for that person, selfish for their family, and selfish for the society. How do you make that happen? Because it's far more easier to be satisfied by those dopamines released by the bad foods than the steps taken to be healthy. But if we can find a way to make that happen, where the AI can provide what you call a body age, or what you can now classify as biological age, and you can say that, hey, there's a chronological age and there's a biological age, and if insurance was provided on the biological age, I know there's still science yet to be developed to get to the point where this can be connected to actuarial science to make this happen. But if we are able to get to a point where incentives are aligned, right, from the government, from if I'm hiring a candidate and I know that this candidate is 5 years younger, then I have a longer this thing with this candidate. I know the candidate's, my ability to depend on this candidate is much better. So I'm saying in many other ways, job, day to day, if it is impacting the person, right, then I think the behavior change will be far more faster. Otherwise, we'll be a little slow around this. So I feel that AI is reaching a point where it can be made very relevant, saying, am I going to see my grandson's being born? Am I going to see my grandson's wedding? Right? And if I have to calculate that, and if I'm going to be around or not. And then so things like this, right? And you can actually make it more scientific, saying that you're celebrating your 40th birthday, but actually you're 60.
So summaries know your biological age. And if you cannot start a company which can help you find that. But Dr. Nachiket, when you're designing a regional or national health systems, are you thinking about preventive healthcare?
One of the things that I was hoping Shashank would say, but it's something to keep in mind. A lot of what we are talking about just now is too crude. We don't quite know what will work for us. This whole idea of precision health, like in mental health, counseling doesn't work for everybody. But we discover it only after 6 attempts. In cancer, the same medicine regimen doesn't work for everybody. And for a long time, people didn't understand how to link the cancer medicine with the appropriate, genotype to make that combination happen. I think with the kind of data that both of them bring, precision medicine, so I know exactly what's right for me. And I wouldn't, in my mind at least, wouldn't separate lifestyle and medicine this starkly.
Okay.
If you need to start statins, start now. The sooner you start, the less damage you're going to leave this idea that somehow this is holier and this is less holy, I don't subscribe to. Whatever works. Right? If you need an Ozempic to help you start down the journey of weight loss, long-term Ozempic use, we don't have enough data yet. So we don't know what the side effects will be, what the issues would be. Will the body, like Diet Coke, used to be at one point the wonder thing to reduce sugar. As it turned out later on, the evidence started to build that your satiety signals have vanished.
Yeah.
Because now the body is getting confused about the sugar hit. Am I full? Am I not full? Now it's ignoring that. The other possibility, which we have to understand much better, is how can we break intergenerational transmission? We now know, for example, if the mother has got HIV/AIDS, the child can be prevented from getting HIV/AIDS in the womb. we have some idea now of if there is a diabetes history, can we prevent the child from acquiring that history? Because otherwise, what you will get into is this intergenerational programming. And unfortunately, the environment is stacked against you. Your genetic pool is stacked against you. And earlier we thought genes. Now we know about epigenetics, which means I'm not a scientist, my understanding is there are switches on your genes that can flip in a generation. And once they flip, they stay flipped unless you do something to flip them back.
So can technology help there?
So precision medicine, understanding precisely what is needed for me. Exercise may not work for you, for example, right? You may need something else, you may need a different combination. Today, we are still following fairly blunt recommendations. And sometimes people get frustrated. They say, I'm spending hours in the gym.
And nothing is happening.
कुछ नहीं हो रहा है.
And not to jump on a regulatory point here, but the challenge we have is to import kits who measure this epigenomic changes. There's 30% import duty on it, right? Now how can and not too many people know of doing it and are doing it. But if we are able to, as a country, understand our genes and are able to, and not just genes but epigenes, which are the changes that are taking place as we grow older. It can be, it's not, and like he's mentioning, it's not something that is 10 years ahead. It's available today. It's happening in the other countries.
Map My Genome is doing some good work in genome mapping, right? And trying to relate your genes and what diseases can come.
Absolutely, and there should be more such things. And I'm personally disappointed that the penetration levels of health checkups and genetic testing and the awareness is low. It might also be because the cost is high. For a country like ours, it is still needs to be affordable.
My sense is, Shashank, the data sets you and Viren have and your ability to process them, you're now starting to extract a lot more value, like what you were saying earlier. How can I guide the doctor to be more effective as a doctor?
Yeah.
I remember talking to Make My Trip about this. One of the big values they added to their hotels on their property gave them the understanding of why is that guy charging more money for the same hotel than I am. What is the difference? We are in the same locality, but the customer is going here, not coming here. What you are saying is you have now the ability to do data and then deliver that insight.
So precision medicine, of course, is an upcoming opportunity.
Yeah.
But of course, you need access to data and you need access to some other tools and make it affordable.
Also, you need to know what you're looking for at the end. The thing with genomics, full body genome is just a giant pile of ACTG pairs, and you don't know what to do with it. You can do any number of regression, get any number of correlations, it won't help you. Unless you're able to specifically switch on, find out, okay, BRCA is this thing I look for certain kinds of breast cancer. Oh, these other things are things you look for Huntington's disease. Absent that, you become just lost in the data. And so it is a long-term effort, not just in doing data analysis, but data analysis on specific cohorts of patients in hospitals who, for whether they're in the same family or for generations, have been exhibiting certain diseases. So you get to narrow it down a little bit. Just taking the data, dumping it in a software and say, find something interesting, will not give you the answer.
Yeah, of course. So narrow the use case. For example, diabetes or breast cancer or anything that or cardiology issues which you have. A lot of genetics play a big role in that, as I understand, right? So, so we have now discussed the opportunities across, AI, doctor, diagnostic, precision medicine, and going to specialty and going after it and solving for that in an integrative fashion, right? So now, if I were to create a company today, a digital healthcare company, what is the first thing that comes to your mind? If I have to start from scratch today, and Dr. Nachiket spoke about reimagine the healthcare and start technology first and then doctor as assistant, for example. So what should a founder listening to this podcast should think about first?
See, the way I see it, not enough people are immersing themselves in the real experience of a hospital environment or a primary care environment. They're coming with this, I graduated from this great tech school, I have this great tech capability, now look for build a product and then look for a place to deploy that product. Now the underlying tech is fabulous, right? Unfortunately, it's not designed for any environment that I'm familiar with. And I think this idea that you really wallow in the experiential for a while so that you have a visceral sense of where will I deploy it? Because go-to-market for terrific technologies is failing. I worry that there are too many companies with great ideas. It's like evolution. We'll miss many evolutionary pathways and then reinvent something that somebody had 10 years ago because they didn't really spend time understanding where the market is. Because unfortunately, the business of making things happen is not just a matter of inventing something great.
So understand the environment in the hospitals or current healthcare system.
And spend
absorb it
time on
fully.
primary care, understand what primary care is like. There's so many people experimenting with so many different ideas. And start from there inductively to
Understand.
build something.
I'll put it even more simply. How are you going to make money? Who's paying for it? And is the person paying for it the person going to benefit from this thing that you are planning to make? Sure, you make money. How much are you going to benefit? If it is a lot, charge a lot. If the benefit is marginal, they're not going to pay you a lot. And compare that against your cost to build the thing that you're trying to build, whether it's a service or an app or a product or an AI, whichever it is. If you don't know who it's benefiting and how much that person is willing to pay and how much of a problem that is, you will never even get off the ground.
Got it. So understand, follow the money trail, see who is going to benefit, and then see how to carve out the service or a product around it. Shashank?
So I think that, I think there are two, and having done this for 16, 17 years, I think two things to, the healthcare takes more time. I think that has to be factored in because you're dealing with the most complex system in the universe, the human body. Right? Still,
And not
humans
just
are not
more time, lots more time.
Okay, lots more time. So, prepare yourself for that. And I think technologists in general have less patience. And so I think if there is a digital health startup to be created, if you take an average companies to get successful in X, I would say 2x, maybe Viren might say 4x. Okay, 3x. 3x is fair. So that has to be factored in, that you need to, the good part is you get a lot of satisfaction in the space. It's a healthcare space. You're helping yourself, your family, nothing more important, impactful than that. And the country, nothing more impactful than that. But the trade-off is time. You need to trade off time. The second thing a technologist usually makes a mistake on is in the technology space, its ability to make things more convenient and cheaper is natural. That's where people gravitate towards. But healthcare has a slightly different thing to it. Healthcare is all about improving outcomes. And it's about improving outcomes, it's about improving quality. And that's what the contribution of technology first needs to solve. It can also make that quality at a cheaper end, but quality has to be the paramount focus.
So don't compromise on the quality. So focus on, induct yourself in the hospital system, look at the money trail, look who's benefiting, and then it will deliver quality.
And I would say more than even thinking about lowering quality, think about how to improve quality, and people would pay for that. Now it's not easy, but there are gaps. There are gaps in quality, and that can be addressed with technology and through the right partnership. So that is the second one, and I completely agree with Viren that healthcare being more regulated, the ability for you to understand the flow of money is very important. So I wish I knew this earlier. There are 3 P's in healthcare that currently are the profit pools. Currently, I use the word currently, and this could change. It is procedures, which is surgeries, procedures. It is pathology, diagnostics, and it is pharmaceutical manufacturing. Right. So these are the 3. Now, of course, there could be more, but these are the current 3 largest ones. So these are the things that I would keep in mind. That it's going to take more time. You cannot compromise quality. Better off improve quality and know the 3 P's where the profits lie today, and be aware of it as you get in.
So being patient, basically. So
yes,
and that I think is hallmark of building any great business, any which ways, right? Nothing comes so fast and comes so easily. So you have to work hard for it, of course. So I think there's one question I want to ask all of you. Why nobody is able to solve the, annual health checkups? It's a very frustrating experience, right? You go to a doctor, no matter, or to a hospital. It takes you half a day or full day. You go to, 20 such machines or places, and then the outcome is still not the outcome that you would expect, right? And this is a very, very harrowing experience. Can it be solved in India? Because I'll go a lot into the preventive healthcare, right? If I'm very, very, the reason that I don't go, or many people or many friends don't go to annual health checkup is because it is the most frustrating experience. 1 day and 25,000 rupees if a premium checkup, or 10,000 rupees for a normal checkup, for a annual checkup goes away, right? So can we simplify that?
Yes. Can I use this opportunity to pitch my idea?
Absolutely. Absolutely. I know you've done a lot of work on.
So we've done work on a 1-hour annual health checkup.
Okay, I'm going to come to your hospital next time.
So not our hospital. That's the other thing.
Okay.
The reason why it is such a miserable experience, in the hospital, you're coming for annual health checkup, you are healthy. You're a normal person. You're not a patient. You're just going to come, you're going to utilize all the machines, you're going to waste the doctor's time because you're healthy, and you'll go. So you are lowest on the priority in a hospital. Hospital is for sick people. You should not be in a hospital for annual health checkup. So in Sarjapur, in the Prestige Tech Park, we built an area that is nothing like a hospital. It has all the MRI, all the CT, all the echo, DEXA scan, ultrasound, ECG, medicine, pathology, blood draw, whatever you need. All there in a place where thousands of people come and work. So there, because there's no distraction and because everything is done in a planned manner, you can't just walk in, you have to make an appointment. So we know exactly when you're coming, we'll be ready and waiting for you. And then when you come, our guarantee, in 1 hour, we'll be able to do all the tests that you require.
Wow, that's amazing. I'm definitely coming there.
So it's simply why you fix it by making it in a very different environment and reimagine from the ground up. If I were hyper-focusing just on this one thing, how would I design it? And that's what led to this idea.
I'm very
for us.
glad you're doing this. You know, I had a similar conversation with my wife. The lockers, the way you put gold, is also a very harrowing experience. You go to a bank when Diwali is coming or some festival is coming, you're always rushing, and then you forget something, and it takes you 48 hours to get the jewelry that your wife or your daughter wants to wear. And today there's a startup who's putting all these things in a community. For example, you don't have to drive to a bank. So in your own community, for example, in Bangalore, like Prestige Tech Park or one of these buildings, they have this locker facility within the facility, integrated in the residential complex. So you go there, come from your car, you can even get ready. There's a mirror there. So I'm just giving an example to talk about how a particular experience can help you drive towards a particular outcome. This also leads to your outcome, right? If I am very careful about my health and my experience is really, really good when I am healthy, then I have the chance to actually improve my outcome because then I'm working on myself regularly, right?
See, the one way to go is what Viren has said, and I've seen that facility is just marvelous, right? But it is invented in a transactional environment, in an environment where there's no continuity of contact. There should be no need for an annual checkup, right? You're meeting on average, you're taking a primary care consult 3 times a year per individual, right? There's enough opportunity, right, for a continuous transaction to happen with you and the doctor. Unfortunately, what happens is, when you go to a hospital or a doctor, you're sitting idle for hours. Nobody has bothered to say, well, you're sitting here, why don't I do a blood draw, in fact, people don't even ask you the basic questions, right? So it's possible that in a way we are inventing a solution to a problem we have created by not having continuity of care. Like somebody like, for example, Shashank could do. His patients are showing up, there's 40 crore patients that he has, again and again and again. How can he make the annual checkup unnecessary? And to say, I have enough data about you, not because I did anything unusual, because you spoke to some doctor or the other in my system 15 times last year, that's enough for me to tell you what you're not doing, but you should have been doing.
Okay, so get more precision medicine will then come into play. That
From the existing data set.
I understand.
Not new data necessarily. But there may be the odd test, because there's a little bit of a problem also with excessive testing. All these variables, the noise is too high. The science is not there yet. We don't understand human body as well as we think that we do, right? Continuous monitoring of my blood pressure. The fear is I will end up with too many procedures, too much panic, too much anxiety. The science is not able to tell me with any high degree of precision what is really the meaning of all this.
I understand.
So that's the other problem.
Yeah, just to come in there, I think that the challenge in healthcare is that it is always, not always, and it's for real reason, it has this negative connotation, right? That it is, the connotation when you think of it is that I want to avoid it, right? I want to avoid it, I want to stay as far away as possible. Mm-hmm. I want to not involve myself. I pray that I don't do any of this, right? Yeah. Now that's fair. That is fair. But, you have given a body, so you have to take care of it.
But
now, how do we
convert it?
Because the experience
is really bad, Shashank.
I think I'm coming there, but I think that experience has also a positioning problem, right? The positioning is not that, hey, can I get peak performance? I have a body, can I get peak performance? It's how do I not die? How do I not have sickness?
So just the left tail, not really the whole distribution.
Yeah, exactly. Like if we convert the conversation that how can healthcare provide you peak performance? Forget preventive. Everything is talked. How do I not die? How do I not get sickness? How do I not?
Great perspective.
The problem is that it's revolving around a negative connotation, and that's when it's always at a fundamental level seen at negatively. But if it was done to say that, hey, do this and you'll earn more. Your peak performance would lead you to better cognitive load, which will lead you to better promotions. Your ability to invest in stock markets will go up. I don't know what will.
You can spend time with your kids and play with them in the evening, not get so
I think
tired.
the great example is cricket, for example, or sports,
Yeah.
right? Where they actively work on the peak performance.
Yeah, and so how can we convert it from even preventive, right? I think we are going from curative to preventive, but even from preventive to peak performance, and say that, hey, can we start there?
Terrific idea.
And so that would make the consumer think of healthcare more as an aid in my growth journey rather than an aid in my dying journey, right?
And of course, the quality of
In a
life will also
perception
improve
way.
massively.
Yeah.
No, even in the mental health work, one of the new papers that we are working on is, in the workplace, people are talking about, oh my God, too much stress, too much work. We are switching that conversation to say, how can I build a high performance workplace? Stress is a reality. I can't get rid of it. But how can I convert that stress into high performance rather than simply preventing people from falling sick? And there are multiple mechanisms that one can deploy. I really like this perspective.
Yeah, so from curative to preventive and then to peak performance,
Yeah.
right? I think absolutely brilliant. So while we're talking about all the opportunities and what can be done, let's discuss a little bit about safety and data protection and everything else, right? Because that is always lagging behind it, and it is patient's data in the end, right? And we've already gone through the internet era where our data is all owned by internet companies in many ways, right? They know more about us than we know about ourselves, at least about our lives, right? So in healthcare, of course, a lot of regulation comes in. And a lot of ethics also come role to play. So what's your view on safety and regulation?
I think the Indian government has done a great job with the Data Security Act. And the second thing that the Indian government has done, which I think is the first in the world, is the invention of the ABHA / Digital Health Mission, where a federated data architecture has been created, where data is owned by the patient, temporarily residing in servers of companies, which is a fantastic conceptual thing. At a practical level, it's taking more time than a digital public good like a UPI because of its nature. But I think over time, it'll take slow time, but it'll tip over. Where what Nachiket was mentioning about a consumer being able to see himself entirely, would be able to stitch, because he's going to a Lal Path lab, then he's also going to a different hospital, then he's going to a different pharmacy. All that is data is being stitched at the back end by the government and being given, and when I say by the government, by this digital public good, owned by the patient. So new startups can use that data and create this. It's going to take time. So I think an important point to plug in here is one needs to understand how to make this something that could result in revenue, and that's something that has to be stitched together.
Yeah, I mean, a lot of work is happening, in fact, in Bangalore about it. So you can become a CEO of your health in a way, right?
Yeah.
Because you have all the data in your control and you can see it. But so that is one aspect where public good is getting created. But for a startup which is getting created today on who are digital health, what are the things they have to be careful about?
I think all the servers today come with HIPAA compliance. I think that's and there are enough number of ISO. I would say there are enough number of certifications that one can take to legitimately call themselves safe and secure. I think those things are. I think the main challenge is that what you say in letter has to be also followed in spirit, and that's where I feel that there could be gaps. But my only thing I would say is that build a long-term business. There are no shortcuts that are worth doing, whether it's on data, privacy, and this is a very highly sensitive. Even if one patient record with mental illness or any kind of illness is leaked out, it could lead to your company's trust is completely eroded, and that could lead to shutdown. I mean, we have seen how social media escalations have had disastrous impact on public companies, which are providers, and they've had just one incident of inflated bills could bring down your brand image by a huge margin. So it is, I think there is real reputational damage and existential damage to digital health companies if they take security and safety for granted. But there are enough tools, I would say, to manage it. But I worry more about the spirit than the letter and the technology is available.
So like you said, there's no shortcut to success, and even more in healthcare, you have to be very, very sensitive to patients' data, no matter how small it is.
I can give you one example.
perspective
I'll just tell one
sorry.
example. Sorry, is that one outsourced partner in a Chennai beach, the American health record. So there was somebody was walking in the Chennai beach and they found a paper, and it turned out to be a health record of an American patient because the transcribing was being done in Chennai, and it came in the famous beach of Chennai. And so the company had to shut down, literally, right? Its revenues. I mean, because in US, some kind of a leak like this is disastrous. So I just want to share examples that even a small inadvertent leak could be disastrous for the company.
I also want to build on something Viren said. One of the issues with technology now is that you can't say I have anonymized and it's enough. I can de-anonymize based on your DNA, right? I didn't put your name, but I have everything else about you. And now I can work backwards to say who you are. It's a longer search process, but I can find out. The question I think Viren pointed out, which is very important, is don't just collect data and keep in the hope that somewhere in the future you'll mine that data to produce some insight. Be thoughtful about what data you want to keep and what data, the phrase I like is plausible deniability. I could not have leaked it because I did not have it. Right? Delete. Have delete algorithms. Make sure you're keeping only the data that you need and that you can use. Otherwise, this kind of problem will emerge because no matter what you do, the next cyber attack could pull the data set from and a small startup doesn't have the ability to have a full team of people watching against, cyber threats. Keep minimal amounts of data, that only what you need, and use it properly. If you don't need it, delete it.
I understand. And Viren, we're talking about accessibility and affordability of healthcare, and insurance plays a big role. We were talking about before coming to this call, and you launched just an insurance product, as I understand, right? So let's talk about a little bit more inclusion. How insurance can help healthcare being more inclusive.
Yeah. I'm glad I get to pitch two of the things my company does in this meeting. I'm very honored. We were the pioneers in bringing low-cost healthcare to India, which is tertiary care that people can afford. But what we found is that, say, heart surgery cost 4 lakh rupees somewhere else, you do it for 2 lakh rupees. You do it for 1 lakh rupees. You can do it for 1,000 rupees. Your customer is still unhappy. Why? This is not something they look forward to. This is not like planning for iPhone 16 where I'll stand in line and I'll get, heart surgery version 16. No, nobody is happy in a hospital, to Shashank's point. Yes, the experience is bad, but being sick is a miserable experience. Anyone who has COVID will know. It's the worst. You cannot function as a person in your normal life when you are slightly sick. So you're not happy parting with any money. And so no matter how much we found out, we are trying to reduce the cost, work on the efficiencies, in the end, the price sensitivity of patients to pay is enormous. So we said we need to go back to the drawing board and to completely flip the script. And earlier on, they had said about prevention. How do I pay for peak performance? What do people pay for when they go to a hospital? They're not paying for medicine, they're not paying for surgery. They're paying for the right to go back to their home just like they were before. They want to be healthy, they want to be well, they want to be their best self. So we said, if I have to design my healthcare system around a program where you don't pay me for heart surgery, you pay me to keep you healthy, I need to have several things in place. One, I have to have steady stream of money every month coming from you. I need to have doctors who not thinking about you as, okay, that knee, I can do something for that knee, or that, gastric issue, I can give you some medicine for that. No. You are a whole person. You are Manav. You are someone, I want to keep you healthy. I want to make sure you go and attend your great-grandchildren's wedding. So what are the things I need to do for that? Right? Whether in the end it's still some combination of lifestyle and surgery or so on, it still doesn't matter. But I need to take care of you holistically. So hire a bunch of people who can take care of that. Now, how do we tie it all together? What does healthcare as a subscription look like? And we said, okay, people understand that already. It's called insurance. But we had to reimagine insurance again a lot, because insurance today is it's like paying for a credit card that sometimes swipe and most of the time does not swipe, and it doesn't swipe in all the places. Sometimes you have to pay out of pocket and argue with the credit card company, hey, it didn't swipe for the amount. That's a miserable experience. If we have to redesign it, You have to make sure that it covers everything, it is comprehensive. But the trade-off is that you end up with a very small network of people who are like-minded enough to say, no, I'm not here to take away all the money in your wallet, I'm here to take care of you. So that is the genesis of our insurance company. So we rolled out a program. The first thing we call Aditi, the next program we call Arya, which will work with people to keep them healthy, to keep them out of the hospital. And I think that is the direction in India healthcare should go. Because 1 lakh rupees, you pay once, maybe you have it, maybe you don't, it's still a huge hit.
Yeah.
10,000 rupees over 10 years, why not? See, that is the story of two-wheeler purchasing in this country. That's the story of home ownership. How many people today, if you say buy a home, you pay out of pocket? No one. The apartments, real estate stocks will collapse. Same for two-wheelers and four-wheelers. Everything is on EMI. Even your health can be on EMI.
Oh, that's a great statement. Health on EMI. So, Dr. Nachiket, of course, you're an expert in financial inclusion. You've done a lot of work. So, what is your view on integrating insurance into healthcare?
No, I think it's a powerful idea. See, the reality of India, which somebody like Dr. Devi has been talking about for a long time, our ability to deliver high quality healthcare at extremely low cost is there. Right? We can do things at a fraction. I have a paper in which I estimate what is the implied exchange rate, rupee dollar, for healthcare. 80 rupees is the nominal rate.
Right.
20 rupees is the IMF PPP rate. The implied healthcare rate is 3 rupees to the dollar. Right? 5 rupees to the dollar. Very low. But it's not enough to just say that. Right? At the end of the day, an individual needs to see. Viren spoke about 1 lakh of rupees. Unfortunately, if I need a bone marrow transplant, I need several more amounts. Right? But the probabilities are very low.
Yeah.
To the insurance premium, that will add 2 naya paisa. Right? If we can build a structure with our current incomes, we can afford to pay for these services. Nothing like it. Now, of course, this is where government will also have to play a role, because voluntary insurance, a portion will buy.
I understand. Can technology play a role in that?
See, at the end of the day, we are today in an environment where we are all connected to Google Pay, we are all connected to this, that, and the other. Is it possible for me to build a health savings account where for every transaction I'm doing, 1 naya paisa, 2 naya paisa goes into
A health savings
something
account,
else? Automatically, I don't even see it. Right? These are amazing opportunities where tech can play a big role. I pay a toll on FASTag.
Or like SIP, you have mutual funds. You have similar schemes for your health service as well.
So health savings one can do. Clearly one can build health savings properly like that. You need also like-minded providers though, because it's not simply enough to have the money. Right? There are many instances in which money was not the problem. It's the healthcare that got delivered was actually not appropriate. And what Viren is talking about is really quite an innovation. You've seen, it's not as if, Narayana is the first one to get into insurance. There are many large hospital systems that either got into it or are getting into it. But they've never thought about it in the same way as Viren just expressed.
So can a startup start another health subscription business?
No, so the role of technology in insurance. See, insurance is, on the one end, if you're collecting money, that's a distribution problem. And if you're delivering the care, it's a coordination problem. Both cannot be solved without technology. On distribution side, without a paying system, it will just be dead in the water, because there was a time until very recently in the West, you had to write down check to the insurance company to mail. And they used to have armies of people just to verify whether you paid or not. Similarly, on the provider side, we need to be able to know when you're coming, who is coming, and who I need to be ready for you when you come. So there is a tremendous role for technology in being able to democratize access to health insurance.
So what do you think, Shashank? Practo is going to launch insurance product? You're hearing both sides right now.
I think we have a lot on our hands already. So, but I couldn't agree more.
Would you advise the startup to look at this opportunity?
Absolutely, because there's a problem of incentive alignment, and I think that there's a huge scope in making healthcare, more approachable. And I continue to bring in that consumer and not use the word patient, because we need to catch the patient before it becomes a patient, right? And that's why the consumer mindset is helpful to make sure that it doesn't convert into a patient and then it gets delayed. So I think insurance has the right incentive and that's the right model worldwide that goes. I only hope that I think the very important point is that, the capital is required, and you usually get access to capital through VCs and venture capitalists. Venture capitalists have a particular time horizon for their exits. In that time period, you need to find a problem, you need to solve the problem, then figure out, make sure that the problem solves a consumer benefit, has an ecosystem benefit, also makes money, and then you find a way to return them capital back to the investors, and then recycle it all over again. So where I have a suggestion here is that, especially in innovative ideas, like let's say in case of health insurance, that both we need to think through for these younger companies, how can regulators make sure that newer models, they are far more flexible with of course boundary conditions put into place, how VCs are also investing with certain level of awareness on how much time it takes in healthcare to generate a ROI. So I think these two ecosystem partners have to also give this space more time to breathe and more time to innovate, but of course without dropping quality or having any adverse impact on the consumer. That is a red line that no one can cross. But from a business model innovation standpoint, I think those are the challenges I do see when new ideas, especially like the ones that you mentioned in insurance, which are slightly more capital intensive, require. I think these two orchestrators have to play a very productive role, and they are, but they need to continue to play a very productive role in letting these ideas, budding ideas grow.
Absolutely.
The other thought I would have is that there are lots of space. Regulation, in one way, is a barrier, but one way it's an opportunity because not too many people can enter that space. Right? There are many interstices in the middle where there are gaps. We just spoke about insurers are not into healthcare, healthcares are not into insurers. Is there an opportunity for somebody to say, I'm neither going to be an insurer, nor am I going to be a healthcare provider? Can I be somebody in the middle that benefits the consumer in a way, and also I know exactly what the insurance need, I know exactly what the providers need. I mean, one has to be creative about it. It's not, nobody's going to write down a script and say, this is the problem, right? But a creative person sitting in the middle will be able to, develop some interesting opportunities.
Yeah, of course. And I think coming back to your point on venture capitalists or investors being patient, I think we're also seeing a lot more traditional capital from India coming back into the Indian ecosystem, right? Which is not the case. So I think we might see more patient capital in India now. Because a lot of founders, we know a lot of our friends also who have made money through IPOs, a lot of IPOs are coming. They all want to help country or society in a way which is more impactful. So I think we may see more patient capital. And traditional businesses anyway used to having a long gestation period, right? So traditional businesses normally takes 20, 30, 40 years to because they get to scale, right? So I think we will see that color. There's obviously when foreign money comes in which wants immediate exit in 10+2 structures. But I think I am also seeing a lot of patient capital coming in, which is traditionally the family businesses of India, who of course also want to make money and also help the society in many meaningful way. So I think we will also see a lot of that coming in. But with that, I think thank you all of you. I think it has been a great conversation. We have covered a lot of ground. We started with talking about the Indian healthcare system, AI, doctor, insurance. I like your phrase of proactive to curative to preventive to then peak performance. And obviously wrapping up with healthcare as subscription. I think a lot of great ideas for founders to take away. So please listen to this podcast and go through various ideas being discussed. Of course, we cannot capture every single opportunity, and it will get further evolved as we go along. But thank you very much, and it was nice having conversation with you.
Thanks, Manav.
Thank you all. I learned a lot from this discussion, I must say.